A strange word that's hard to say, syringomyelia, and a scary word when it comes into your family. It came into mine in 2011 when my aunt was diagnosed with traumatic syringomyelia. Syringomyelia is a disorder where a fluid cyst called syrinx develops around the spinal cord. The fluid can increase over a period of time. This can damage the spinal cord and impact more issues to the nerve fibers that are connected to the part of the brain that holds information and separates the brain from the rest of the body. This chronic condition comes with multiple symptoms depending on how much fluid you have around the spinal cord and where it is located on the spine. This disorder needs to be treated by a doctor before it expands and damages the nerve tissue. Symptoms include discomfort in neck region and glenohumeral joint, muscular dystrophy, tightness and pain in legs, loss of feeling to temperature, muscle contractions, unstable movement, or ataxia. You may also start to get other medical conditions such as scoliosis, which is where the spine starts to curve. Most people will get syringomyelia due to a brain abnormality known as Chiari malformation. This pushes part of the brain down to the spinal canal and forms a cyst. Other causes are tethered cord syndrome and meningitis, also known as arachnoiditis. Tumors can develop on the spinal cord and trauma. On the other hand, sometimes there's just no known cause. They are identified as idiopathic. There are tons of theories out there why people develop syringomyelia. Some hypotheses implicate the blockage of flow of cerebrospinal fluid, CSF, is the main cause. CSF is a clear fluid that gathers around the brain and spinal cord. The reason CSF develops is to protect and soften the area around the brain, which gives the brain buoyancy. CSF is in the central canal, which runs down the center of the spine in infants. The central canal eventually collapses over time. It can involve following a spinal cord injury, SCI. The occurrence, also known as post-traumatic syringomyelia, can come multiple years after the injury. The most common age to get syringomyelia is between 20 and 40 years of age. It's not rare to develop it as a young child or in older adults. Reports show that men are more likely to get it than women. This is because men are more likely to lift heavy weights and usually use their backs to carry the weight. One estimate places that incidence at 8.4 individuals per 100,000 in the general population in the United States. That classifies syringomyelia as a rare disease. Syringomyelia can develop for some type of people without any known cause. These types of cases are known as idiopathic syringomyelia. Most people find out they are diagnosed with syringomyelia due to particular symptoms and detailed patient history. You will be fully evaluated and have specialized tests done. Sometimes syringomyelia can be found when being evaluated for other reasons. Magnetic resonance imaging, MRI, is used to diagnose syringomyelia. An MRI uses a magnetic field and radio waves to produce cross-sectional imaging of particular organs and body tissues such as the brain and spinal cord. An MRI can detect more about syringomyelia, such as an intraspinal tumor of Chiari malformation. You can begin treatment based on the location of the syrinx. MRI is the preferred diagnosis tool to a CT, computerized tomography scan, because it doesn't use any radiation. When starting treatment for syringomyelia, you will be directed based off your certain symptoms. A team of doctors such as pediatricians, neurologists, neurosurgeons, surgeons, eye specialists, ophthalmologists, healthcare professionals may have to make a detailed plan for a patient's treatment. In some cases, there doesn't need to be treatment. Some healing procedures may differ depending upon many circumstances, such as disease, development, and symptoms. They have to acknowledge how the symptoms will affect the condition of life. Age, health, and other elements play a role into this. A physician or healthcare worker will prescribe a plan suited perfectly for you. It is based off side effects, long-term effects, patient's preference, and etc. Patient with no symptoms may not have to have treatment, but should be commonly examined to make sure the syringomyelia hasn't progressed. Some treatments including analgesic, which is a pain medication, physical therapy, limited activity, and no heavy lifting. Treatment will help keep the fluid around the spine the same and take pressure off the spinal cord. Surgery may be used to remove tumors and release tension from the spinal cord. Sometimes the shunt/stent, which is a tiny tube, will be placed into the syrinx. This helps all of the fluid drain outside of the spinal column. When allowing fluid to move from one part of the body to another, it can cause minor symptoms such as headache and pain. Some severe symptoms include spinal cord injury or infection, bleeding, hemorrhaging, and blockage. The long-term outlook for post-traumatic syringomyelia may be difficult to treat. Patients with neurological deterioration and or intractable pain are recommended to get surgery. The surgery expands and decreases the fluid around the spinal cord to decrease the trauma. If shunting is done when the syringomyelia is post-traumatic, it can cause further spinal cord injuries. Shunting is the last resort for many physicians. Surgery can improve symptoms and stabilization for some individuals. Sometimes syringomyelia can come back after treatment. After surgery, you will repeat an MRI scan to tell how much fluid is around the spinal cord. Now back to my aunt. She was diagnosed with traumatic syringomyelia from a lightning strike. Here's her story, but I'm going to let her tell it.
It took 2 years to diagnose my syringomyelia, and that was 11 and a half years ago. I started by having pain on the right side of my body. But because I was so active, being a mountain climber as well as a teacher who regularly took my students on overnight field trips, my doctor just took an x-ray and told me that I had arthritis and had probably pulled a muscle. Chiropractors didn't help. Physical therapy didn't help. In fact, after a while I was having difficulty walking and I could no longer go on hikes. Finally, an MRI was ordered, and it was discovered that I had a syrinx that went from the cervical disc 6 to thoracic disc 10. It had compressed my spinal cord to less than 50%. It also showed that I had a dorsal tethered spinal cord. They did surgery within a week, and the neurosurgeon recommended that we put in a subarachnoid shunt. In trying to correctly diagnose whether the syringomyelia was idiopathic or traumatic, the doctors took an extensive medical history and kept asking if I'd been in a car accident or a bad fall while hiking, and I hadn't. Then I mentioned that I had been hit by lightning twice. Everyone became extremely excited. When I mentioned that it had occurred more than 20 years earlier, they still couldn't decide if the diagnosis was traumatic or idiopathic. It didn't really matter to me. The surgery was performed and the subarachnoid shunt was inserted between T4 and T5. Things didn't go quite as planned. They told me I would be up and around and out of the hospital within 2 to 4 days. I actually woke up after 2 days, and I was completely paralyzed from T4 down. After 4 more days, I got full movement on my left side of my body, but no feeling. 3 weeks later, feeling in the form of pain returned on the right side of my body, but movement was erratic and uncontrolled with severe ataxia and spasticity. After 6 weeks, I had learned how to sit up, stand up, and walk again, although I still have difficulty with proprioception and balance. That was 11 and a half years ago. I'm going to be 65 next month. Since the average age of death for someone with syringomyelia is 47, I'm beating the odds. Oh, and by the way, I do still have it. The doctors check me regularly. I just had my 93rd MRI. Things are stable for now.